Hello and welcome. Today, we're diving into a common yet potentially serious digestive system disease, cholecystitis. We'll explore what it is, what causes it, how it affects your body, and what you can do about it. Get ready to learn about cholecystitis. Cholecystitis, at its core, is inflammation of the gallbladder. But what triggers this inflammation? The most frequent culprit, in over 90% of cases, is gallstones. These hard deposits, primarily made of cholesterol or bilirubin, can block the cystic duct, the narrow tube that drains bile from the gallbladder. Less common causes include tumors obstructing the biliary tract, gallbladder sludge, a thick mixture of calcium bilirubinate, cholesterol crystals, and mucin, infections, reduced blood supply to the gallbladder, and even certain medical conditions like diabetes or prolonged fasting. Essentially, anything that prevents the gallbladder from emptying properly can lead to inflammation and subsequent cholecystitis. The process of cholecystitis unfolds in a series of events. First, an obstruction. Typically, a gallstone blocks the cystic duct. This obstruction prevents the gallbladder from emptying bile, leading to a buildup of pressure within the gallbladder. This increased pressure irritates the gallbladder wall, causing inflammation. As inflammation progresses, the gallbladder wall becomes thickened and edematous, further compromising its ability to function. In severe cases, the inflammation can lead to bacterial infection, acute suppurative cholecystitis, tissue death, gangrenous cholecystitis, or even gallbladder rupture, a life-threatening complication. The inflammatory process also triggers the release of inflammatory mediators, contributing to pain and other systemic symptoms. Cholecystitis is a relatively common condition, affecting millions worldwide. Gallstones, the primary cause, are more prevalent in women, particularly those who are pregnant, obese, or taking hormone replacement therapy. Individuals of Native American and Hispanic descent also have a higher risk. The incidence of cholecystitis increases with age, and those with a family history of gallstones or certain medical conditions, such as diabetes, Crohn's disease, or sickle cell anemia, are at greater risk. The symptoms of cholecystitis can vary, but the hallmark symptom is usually a sharp, cramping pain in the upper right abdomen. This pain often radiates to the right shoulder or back. It typically occurs after eating a large or fatty meal. Other common symptoms include nausea, vomiting, fever, chills, abdominal bloating, and tenderness to the touch in the upper right quadrant of the abdomen. In some cases, jaundice, a yellowing of the skin and eyes, may also occur, particularly if the common bile duct is blocked. It's important to note that the severity of symptoms can range from mild and intermittent to severe and constant. Diagnosing cholecystitis involves a combination of physical examination, medical history, and diagnostic tests. During a physical exam, the doctor will check for tenderness in the upper right abdomen. Blood tests can reveal elevated white blood cell count, indicating infection and abnormal liver enzyme levels. The most common imaging test is an abdominal ultrasound, which can visualize gallstones, thickening of the gallbladder wall, and fluid around the gallbladder. In some cases, a HEDI scan, hepatobiliary immunodiacetic acid scan, may be performed. This nuclear medicine test assesses gallbladder function and can help identify blockages in the biliary tract. A CT scan may also be used, especially if complications like perforation are suspected. Cholecystitis can be broadly classified into two main types: acute and chronic. Acute cholecystitis, as we've discussed, is a sudden inflammation of the gallbladder, typically caused by gallstones. Chronic cholecystitis, on the other hand, is a long-term inflammation of the gallbladder, often resulting from repeated episodes of acute cholecystitis or chronic irritation from gallstones. Chronic cholecystitis can lead to scarring and thickening of the gallbladder wall, impairing its function over time. There are also other specific forms of acute cholecystitis, such as emphysematous cholecystitis, caused by gas-forming bacteria, and a calculous cholecystitis, inflammation without gallstones. But these are less common. Treatment for cholecystitis depends on the severity of the condition. Acute cholecystitis often requires hospitalization. Initial treatment typically involves pain management with medications, intravenous fluids to prevent dehydration, and antibiotics to combat infection. In many cases, surgery to remove the gallbladder, called a cholecystectomy, is necessary. Cholecystectomy can be performed laparoscopically, is minimally invasive, or through open surgery, depending on the individual case. For patients who are not good candidates for surgery, a percutaneous cholecystectomy tube may be placed to drain the gallbladder externally. Chronic cholecystitis is typically managed with dietary modifications and, in most cases, elective cholecystectomy. While you can't always prevent gallstones, which are the most common cause of cholecystitis, there are steps you can take to reduce your risk. Maintaining a healthy weight is crucial, as obesity increases the risk of gallstones. A balanced diet that is low in saturated and trans fats and high in fiber can also help. Regular exercise is beneficial. Avoid rapid weight loss, as this can also increase the risk of gallstones. If you have a family history of gallstones or other risk factors, discuss preventative measures with your doctor. The prognosis for cholecystitis is generally good, especially with prompt diagnosis and treatment. Most patients who undergo cholecystectomy experience significant improvement in their symptoms and can live normal lives without a gallbladder. The body adapts to the absence of the gallbladder, and the liver continues to produce bile, which flows directly into the small intestine. Recent research is focused on developing less invasive techniques for gallbladder removal and exploring alternative treatments for gallstones, such as medications to dissolve them. Understanding the complex interplay between genetics, lifestyle, and gut microbiome in the development of gallstones is also an area of ongoing research, paving the way for more targeted preventative strategies in the future.